Good afternoon. Thank you for joining us for today's coronavirus press briefing. I'm Caroline James, in for Donna Bush. Welcome to our viewers on CIGTV, YouTube, Facebook, and our listeners on Radio Cayman. Remember to subscribe on YouTube and adjust your Facebook settings so you know when we're live. And we'll start today with a prayer from Pastor Garrett Haylock.
Blessed is the nation whose God is the Lord, and the people whom he hath chosen for his own inheritance. I will lift up mine eyes unto the hills, from whence cometh my help. My help cometh from the Lord, which made heaven and earth. Let us pray. Father in heaven, we give you thanks and praise for your goodness and mercies that has been extended towards us. We thank you for a blessed little country, Lord. You have founded it upon the seas and established it upon the floods. We thank you, Lord, that in troublesome times like this, we know where our help comes from. We thank you, Lord, for our government, for our governor, and the entire parliament, Lord, that is seeking for our best interests at this time. We pray, Lord, that you'll bless these briefings that has been coming to us daily, realizing the much work it is to put them together on a daily basis. Guide us, lead us, and direct us. And as the people of these islands, help us to be obedient to all of the regulations that is set in place. In Jesus' name, amen.
Amen. In the room with me today are our panel, His Excellency the Governor, the Honourable Premier, the Honourable Minister for Health. We also have the Chief Medical Officer and the Commissioner of Police to deliver their updates, and the Director of Hazard Management in case there are any questions for her. Our sign language interpreter, Ms. Carolyn Powell, is also with us today. At Government, we're continuing to practice social distancing, so members of the media will join us again today via Zoom. Welcome to them. I'll hand over first to Dr. Lee for the medical update.
Good afternoon. There are 15 results to report today. These are 5 positive results and 10 negative results. Of those 5 positive results, all of these are direct household contacts or contacts of the cases that I've previously reported to you. I also have, in addition, to report one further positive, which was an inconclusive result, which CARPHA has now advised is a positive case, and that again was a community-acquired case. That brings the total to positives. We have 28, negatives we have 237, total samples tested 265, and we currently have no inconclusive results. There's no change for the reports for Little Cayman and Cayman Brac. Of the people that I previously discussed, not those from the last 2 days who clearly have only recently been contacted by public health, 15 are clinically better. 1, who I've reported yesterday, remains an inpatient at the Health Services Authority. I wanted to take this opportunity to describe about the duration of time that we are asking people to remain at home should they have any symptoms. I know there's been the query that in the United Kingdom, and in particular, I believe, Prince Charles has been advised that after 7 days he may leave his home. The reason that we've kept it at 14 days is that Cayman's not in the same position as the United Kingdom, where it's considered that the disease is widespread in the community. At the moment, we're still very much trying to suppress the cases and do as much containment as possible, and therefore the 14 days remains the time period which, if you have any symptoms, we would hope you stay at home until the symptoms have gone, whichever is the longer. The other category is if you have actually tested positive for COVID, and if that is the case, you will be retested by public health and advised by them at what period you can leave the home. But please, if there is anybody in your community who has had COVID, just remember, it is highly likely that they are the most protected in the community because they will have developed protection with their immune system would have developed protection to COVID-19. So just to say finally, please do stay at home at this time. That is what is protecting us. If you stay at home and don't meet other people, that is how you're going to protect yourself from catching COVID-19. And if you have to go out for any reason, and make sure it's a reason that you can absolutely justify is something that you cannot do without, then stay 6 foot from people, maintain your hand hygiene and your respiratory etiquette if you have a cough or sneeze. I'm pleased to see a lot of new faces when I do my daily exercise, so I hope that some people are able to use this opportunity to do some good for their bodies and get a bit of fresh air into their lungs. Thank you.
Thank you, Dr. Lee. Now, CIGTV's Donna Bush is standing by for us with some questions from the public. I know she has some for you, Dr. Lee. Good to see you, Donna. Go ahead with your question, please.
Hi, good afternoon, everyone.
Good afternoon.
Dr. Lee, this question pertains to monitoring of those who have tested positive. I think many in the community just want to have some reassurance as to what steps are in place to properly monitor the movement of the people who have tested positive so far.
So people are required under law, if they've tested positive, to stay put in their household and not to leave their household. If there's any report that they have left the household, we will be asking for the assistance of the police in making sure that the law is upheld. As far as checking on people, Public Health contacts all relevant parties on a daily basis. The number of people that have been allocated to the Department of Public Health has increased quite a bit, so that they have better able to provide surveillance and to track and trace any people who might have the condition.
Okay, thank you for that answer. That's it for Dr. Lee for now, from me.
Thanks, Donna. I know that Cayman News Service has a question for us. Wendy, go ahead.
Thanks very much, Caroline. Good afternoon. Can I ask Dr. Lee, is there a reason why we are planning on quarantining the people that come back on the British Airways flight under strict government quarantine, but yet we're still allowing people that we know to be positive to merely self-isolate at home despite being under supervision? And also, can he clarify the status of the 12 people that he hasn't said are either clinically better or in the hospital? So we've got 12 people that are either, are they sick? What's their status? Thank you.
As far as the students are concerned, we are taking every precaution as we know that COVID is widespread and these are unknown cases. So that's why, because they're unknown, we're trying to take every precaution around them. I think that if you know somebody has a case, then we can clearly say the whole household that lives with that individual person needs to be isolated. But for these unknowns, and I guess it is partially because they're younger and they have a wide connection of friends and may not be able to resist meeting people up, we're taking every precaution. The members of the panel may wish to add further to that. As I'm not quite sure what you mean by when I say the 12,
Yes.
12 that I haven't
Sorry, Dr. Lee, I think you're misunderstanding my question. My question was, we are planning for the flight that's going to come next week to put those arrivals in official full-on government quarantine. They are not allowed to go anywhere. They're going to come off the plane and go straight into quarantine. That's what you all said yesterday. However, we now have several people in the community that we know to be positive to have the virus, but we are allowing them to remain at home and to self-isolate and take responsibility for their own quarantining. I'm wondering why we're not being a little more stricter with the people that we know have actually tested positive.
Yes, I heard your question and I felt I answered it as best I can the first time. As far as the other cases are concerned, you mentioned another 12. 15 are clinically better, as I've already reported, but clearly the people we reported on yesterday and today may well be in the early stages of the disease, so we would not report them until we have some history and time to do so.
Thank you.
Reshma from the Cayman Campus, go ahead with your question.
Thank you. Good afternoon, everyone. Dr. Lee, the cases that you've reported on today, you said that they are direct households, but can you say if it is they have travel history, or is this another community transmission that we have reported?
I would, The people, so just to explain, there are 5. 4 of them are related to, they all live in or are related to one household. However, some of them do not have a travel history. I think this stipulation of whether it's a travel or not travel is becoming a moot point now, because I believe that we have clusters that are in the community. So as is demonstrated by that particular household, because they're direct contacts with somebody, but they themselves did not have a travel history. They just were an immediate contact. And the last one again, the 5th one again, was an immediate household contact of somebody who didn't have a travel history.
Okay, thank you, Dr. Lee. It's a question that has been coming up repeatedly in relation to, I know you just said travel history is a moot point, right? But a lot of people are just curious as to what countries are these clusters coming from for the travel history. Would you be able to provide any information on that or not?
It's quite widespread. It's been United States, Canada, Europe, Spain, the UK. It's been all the countries that you might expect.
Okay, thank you for that.
Donna, I think you have another question from the public for us.
Yes, the question is for Dr. Lee again. And I think you may have answered part of this already. How the new household or the cases that have been acquired because persons live in the same household, how long have they been isolated for? And how long before that were they moving freely in the community? Do we have any idea?
I would need to get more information from public health on that. They have been isolated, I'm guessing from memory, for about 4 or 5 days now. But I don't know the details, Donna, I'm sorry. And just to explain to the audience, I'm looking over there because we have a TV screen where I can see Donna, which is why I'm looking in that direction.
Okay, thank you, Dr. Lee.
We'll take one more from the campus and then we'll head to the Commissioner of Police for his update. Reshma, go ahead.
Thank you, Caroline. Just a quick follow-up on the items that we would have ordered, the ventilators and beds. Can Dr. Lee provide us with this update? Or in addition to that, can he tell us about the supplies that we have for vital consumables on island? For example, do we have enough oxygen, sedatives, medicine that would be needed to treat patients with COVID-19?
Yes, I'm not the best person to provide that information because a lot of the bulk of that stock will be held at the different hospitals and pharmacies, and clearly the largest of that is probably going to be the Health Services Authority. I do know that there are 4 ventilators that we previously said were here, and then I had to correct myself and said that they weren't here because they were due to arrive, but then didn't actually, have now arrived and are actually being commissioned at the Health Services Authority. We have a lot of orders out from a variety of providers right across the globe, and what our current strategy is to try to bring all the orders together into very large orders and to present these very large orders to manufacturers who we already know or have vetted in some other way in order that we can get supplies, because it could well be that we need to have special air transport in order to get those orders to us. That's the current situation, and I can assure you that there are loads of people who are working on this in order to try and achieve it. And we're using really good contacts. For example, Health City comes from a group of hospitals, which is clearly a large group of hospitals, and they're also been coming in and using their buying power to see if we can secure a very large order for Cayman. But until they actually arrive here, we won't rest until we actually have more supplies here.
Great, thank you very much. Donna, is your question for Dr. Lee? We'll just take that one and then we'll head to the Commissioner.
Yeah, there's some people who are curious as to when the students will be coming out of isolation.
I don't have an immediate update for that for you, I'm sorry, but I think it's shortly, but I don't have an immediate update.
Okay, thank you, Dr. Lee.
Thank you, Dr. Lee. We'll invite Commissioner Byrne to deliver his update now.
Good afternoon. No significant policing issues over the past 24 hours to report. The crime situation remains very stable and there's almost a full compliance with the hard curfew nightly between 7 p.m. and 5 a.m. Little Cayman overnight, no issues arising. Cayman Brack, 4 vehicle intercepted by police, all essential services workers, no breaches of curfew detected. Grand Cayman overnight, 125 vehicles intercepted by police. All were being used by essential services personnel and exempted persons, including the food delivery industry. 2 pedestrians found in breach of curfew and warned for prosecution. Turning to this morning, the traffic flow is going well during soft curfew. Police checkpoints remain in place at strategic locations around Grand Cayman. There are some indications that a small number of persons are using secondary routes to move around to avoid interception by police, but in fact they have been intercepted by mobile police patrols. Business at supermarkets continues to be well controlled and well managed. Social distancing protocols are being followed. There is a small amount of activity along the beaches with persons out exercising, and our helicopter and marine units remain deployed on extended tours to monitor activities in the water and across the island. This morning, 7 persons were intercepted by police in breach of soft curfew regulations and warned for prosecution. These were all motorists moving around without lawful purpose. I could continue to have concerns around a small number of persons circumventing soft curfew regulations, posing risk to other members of the community. And mainly what we are seeing are persons moving around reporting that they are just moving around to visit friends. This, of course, is in breach of the soft curfew regulations. A reminder, hard curfew returns this evening, 7 p.m. to 5 a.m. If you have no legitimate reason to be on the road, you should not be on the road. Please stay at home. Thank you.
Thank you, Commissioner. Any questions from members of the media? Cayman Campus, Reshma, go ahead.
Thank you, Caroline. Commissioner, thank you for your report and your update. I want to take the discussion to a different problem, so to say, that the governor identified yesterday with people trying to find patients and their locations overnight. A couple of messages were posted on social media in relation to where these COVID-19 patients are and the communities that they're in. Is there anything that you can address from a policing perspective for situations like this, that people who are actively going out to find the COVID-19 patients or posting about their locations? Can you provide us with possibly some consequences or any offences that this may relate to?
Well, each case will have to be looked on its own merits, Reshma. I think Dr. Lee has already, on earlier occasions, advised that this information is private to the patients and should not be disclosed. I did hear this morning about some social media comments, but I'm not aware of any individual having been identified specifically. I am, and I will continue to monitor that situation.
So, in this particular case, are there any breaches of the law that you can identify, or is it too difficult to pinpoint a particular offence that this may create for people who are doing this?
Yes, we would have to look at the circumstances of each particular case. There's nothing general or nothing specific in terms of the way you're reporting it here now at the moment. If there was a threat imposed on somebody, there was intimidation or harassment, there are certain offences disclosed, but each case would have to be considered on its merits and on the circumstances presented.
Okay, thank you for that. And just to build on it, we've heard repeatedly fake news, circulating of fake stories, information. Earlier today, we had a statement come out from Foster's talking about a rumor that is being circulated in the community about COVID-19 patients, positive staffers. What, if any, offences or any police action can be taken for these things so that we can clamp down on it, given the fact that we are where we are with community transmission? There's a lot of fear and anxiety that is happening within the community. Can you speak to that?
Okay, so that is a specific criminal offence under Section 64 of the Penal Code, I think both His Excellency the Governor and the Premier have previously sent hard-hitting messages on that. I'm aware of some reports circulating this morning. There are a team of officers, small team of officers investigating that at the moment. I don't have the result of the inquiries at the minute.
Thank you, Commissioner. I appreciate it.
Donna, I believe you have a question from the public for the Commissioner.
I do. Commissioner Byrne, your officers are obviously on the front line and all of this. How are they being protected, you know, so that when they go home to their families, they won't be carrying anything home? How are they being protected?
So thank you, Donna, and that's a really key question. So our officers have been working around the clock for long periods dealing with COVID-19. They are all issued with personal protection equipment, particularly the gloves and the hand sanitizers. We are all rigorously enforcing HSA and government guidelines on sanitizing processes personally in our workspaces and environments and in our fleet vehicles. And we emphasize on a continuous basis to all our officers the absolute need to comply rigorously with all of the guidelines, hygiene and health that have been provided through HSA, through the Chief Medical Officer, circulated on the hub and circulated again through our own website and through advisory memos to all of our officers. And so far, and very thankfully, none of our officers have showed any symptoms of COVID-19.
That's great. Thank you, Commissioner.
Thank you very much, members of the media there. We'll turn now to the Honourable Premier for his update today. Thank you, Commissioner.
Thank you. Hello, everyone. I'll start with my customary briefing of the world stats on the progress of this dread disease. In the USA, 235,281 cases, up 20,278 overnight. Total deaths, 5,603, up 501 overnight. Italy, 115,242, up 4,668 overnight. Total deaths, 13,915. New deaths, that is, up overnight, 760. Spain, 110,238, up 6,120 overnight. Total deaths, 10,096, up 709 overnight. China, 81,589, up 35 overnight. Total deaths, 3,318, up 6 overnight. UK, 33,718, up 4,244 overnight. Total deaths, 2,921, up 569 overnight. Canada, 11,068 cases, up 1,337 overnight. 134 deaths, up 20 overnight. Philippines, 2,633 cases, up 322 overnight. Total deaths, 107, up 11 overnight. India, 2,341 cases, up 343 overnight. 68 deaths, up 10 overnight. Jamaica, 44 cases, total deaths, 3. New York, 92,381 cases, up 8,480 overnight. Total deaths, 2,373, up 154 overnight. I want to say that we are increasingly concerned about the state of play here. Today you would have heard the report of 5 more positive cases. The good news, if there is such a thing in this context, is that they are all related to current cases. So at present, there is still no evidence or no significant evidence of widespread community transmission. It is still possible to contain this virus in these islands and to avoid widespread transmission. That is what our efforts have been about from the very start. And we have done almost everything that we know to try to prevent this from becoming the epidemic that it is in so many other places in the world. There is still, though, unfortunately, a lack of sufficient cooperation in some quarters. We have been hammered, myself in particular, over the course of yesterday and today about pool maintenance. This is one example I will cite as to the lack of cooperation and the seeming lack of understanding of the gravity of this current situation. Pools are nice things. I have one at my home. I've had it for nigh on 20 years, but it is not essential. In the aftermath of Hurricane Ivan, my pool and thousands of others on the island lay stagnant and foul-smelling for months. No one died as a result. We are not trying to make people's lives harder. We're not trying deliberately to take away your creature comforts. The point of saying that only emergency services should be rendered with respect to pools is because there are hundreds of people who are employed doing this work. We want them to stay at home. We don't believe that them coming to your house and looking after your pool necessarily poses a great risk to you if you stay in your house. It's the constant interaction of the workers with each other, with other people in the community, stopping at the gas station, going to the supermarket, doing the things that all of us do on a regular basis. We're trying to reduce the incidents, the instances of that human interaction. That's what all of this is aimed at. There are still also too many cars on the road, too many people moving up and down, despite the fact that things are improving. So the government has taken some new decisions, and Cabinet will meet tomorrow to formalize them. The hard curfew, which starts at 7 p.m. and continues to 5 a.m., will be continued for another 2 weeks. The soft curfew or shelter-in-place order, which expires on Monday of next week, will also be renewed. And this time we will endeavor to ensure that the hard curfew and the shelter-in-place order coincide in terms of the length which they run. And a formal announcement will be made in that regard tomorrow. But we are going to make adjustments to the shelter-in-place order or the soft curfew. As of Monday, when the new shelter-in-place order is put in place, only persons whose surnames begin with A through K will be allowed on the road for any essential errand or purpose on Mondays, Wednesdays, and Fridays. Persons whose names begin with L through Z or Z will be permitted on the road only on Tuesdays, Thursdays, and Saturdays for essential purposes. Sunday will become a hard curfew day. We are indicating this now even before Cabinet actually makes the formal decision, and the Commissioner has made his order with respect to the curfew to give people as much advance notice as possible of what the government intends to do. we do not believe that with the evidence we now have of community transmission, that the present way that people are behaving can be allowed to continue, because there is just too much human interaction, just too much activity. If this strategy which we have employed for the last few weeks is to succeed, it requires social distancing to be practiced as far as possible. The government's strategy with respect to how we contain this disease and prevent its widespread through the community is actually quite simple. And it's not something that we have dreamt up ourselves. It's the result of our careful scrutiny of what's transpired and what's worked in other countries. It starts with suppression, which is what we've been doing all of this time. Social distancing, trying to keep people from gathering in groups, trying to avoid as much human contact between individuals as possible. That's what the curfew is aimed at. The second aspect of the strategy, which we have not been able to deploy to any great degree so far because we did not have sufficient test kits, is testing, and if the individual turns up positive, isolation and tracing of any contacts that that individual had and isolating those contacts. When the British Airways plane arrives next week, we will have 1,700 more test kits, and we can then get aggressively into the testing part of the program, particularly with respect to frontline staff, the police, people who work at the supermarkets, those people who have regular interface with others. I can also say today that thanks very much to a number of people, but particular to His Excellency the Governor and the UK Ambassador in South Korea, we were able this morning to place an order for 200,000 test kits from South Korea. We are now working very hard to try to find a way to get them here as swiftly as possible. That will give us more than sufficient to be able to, should it come to that, to test every single person in Cayman and then some. And then we can truly deploy wide-scale testing, isolation, tracing, and further isolation of the persons that we've traced if they then prove positive. My people, that is how we are going to succeed in keeping this virus from becoming an epidemic. But of all of the things I've spoken about, the most critical of them is the social distancing. If you are in isolation, there is nobody you can give it to and nobody you can get it from. It's as simple as that. So when you want people to come into your yard to mow your lawn or work at your pool or work at your AC, understand that every human interaction that you have increases your risk of either passing or contracting the disease, depending what your particular health status is. I want to say just a short word about business. Believe you me, the government is deeply conscious of how hard this is for everybody, and particularly for those people who are in business. We are doing everything we can, and I hope starting tomorrow we'll be able to make some announcements about what we are additional measures we are trying to take to assist businesses to get through this very difficult time. We know it's very, very hard to close a business for 3 or 4 months. But believe you me, it is a lot harder to close a casket forever. I just want to make 2 announcements on behalf of 2 government agencies. some of this is already in the public domain, but I know a lot of people might not have heard. The first is with respect to the collection of air cargo from Customs and Border Control. Customs and Border Control Service would like to inform businesses and individuals who wish to clear and collect their cargo, which arrived by air before or during the COVID-19 public health emergency, to please contact 244-4959 or email customsonlinesupport@gov.ky. 244-4959 or email customsonlinesupport@gov.ky for an exemption letter to complete your transaction. Persons are reminded to use the online calls portal to submit their entry declarations. For those that have already received a release to collect air cargo from CBC, please contact them at the above-mentioned phone number or email address for an exemption letter. Until further notice, no storage fees will be charged for imports that arrived 7 days prior to and during the COVID-19 public health emergency. Let me repeat that, because it was a question that's been asked a number of times here. Until further notice, no storage fees will be charged for imports that arrived 7 days prior to and during the COVID-19 public health emergency. To accommodate the collection of cargo, CBC's transit shed or the warehouse will be open from 8:30 a.m. to 5 p.m. Monday to Friday and 8:30 to 12:30 p.m. on Saturday. Importers are reminded of the daily soft curfews, 5:01 a.m. to 7 p.m. The other announcement I wish to make, again relating to Cayman Islands Customs and Border Control, relates to measures for fishing vessels that have returned to Cayman recently. The Customs and Border Control Service would like to inform the public that the fishing vessels that had cleared outbound prior to the imposition of the travel restrictions and curfew will be cleared inbound with the following stipulations. The crew will have to self-isolate on board this vessel for 14 days as per public health and Port Authority protocols. The vessels will remain off Georgetown Harbor until the expiry of the self-isolation period as per Port Authority protocols. Wholesalers, grocery stores, and restaurants will be permitted to purchase and collect seafood from the vessels, providing the necessary social distancing protocols are strictly followed. No sale of the seafood is permitted directly to consumers. With immediate effect, until further notice and in keeping with government's policy, local fishing vessels will not be allowed to depart the Cayman Islands for the high seas or for another country, and if they do so, it will be on the understanding that Cayman's ports are closed and they may not be permitted re-entry while the restrictions remain in place.
Thank you, Your Excellency.
Yes, okay, thank you very much. Good afternoon, everybody. I start just with a couple of statistics to build on the Premier's. I mean, today we have passed the 1 million mark globally for the number of coronavirus cases, which is clearly a very sobering milestone. I've been asked again about the overseas territories, so the figures for positive cases in the overseas territories are 81 in Gibraltar, 32 in Bermuda, 5 in the Turks and Caicos, 5 in Montserrat, 3 in the British Virgin Islands, and 2 in Anguilla. I want to refer to next week's British Airways flight and send a message to all those people who have been in touch with the travel helpline to book or reserve seats on that. We will be contacting everybody who has been in touch with the helpline, and we do have sufficient seats for anybody. So nobody out there should be concerned that they won't be able to get on the flight. There are still a few seats left if there are additional people who still want to go. I have to underline that we cannot take pets on this flight. There just hasn't been time to set that in place. So no pets on this flight. And just more generally on travel, we've said a number of times now that at the moment the airport is closed. There are no flights in and out. The only flight at the moment is the British Airways flight on Tuesday. But we are aware there are a number of people out there who do want to leave the islands, and we're asking those people to contact the travel hotline on 244 3333 to give us your details so we can build a picture of the position of people out there. But there are no flights at the moment, but that is something which will be looked at in a short matter of time. And I want to just sort of step back a bit and again, in the same way the Premier has, I think, just really emphasise the strategy for what we're seeking to achieve here as we tackle COVID-19. Government has taken some extremely effective, fast and robust action to suppress the spread of COVID-19. Borders are closed, schools are closed, only essential people on the roads, the shelter-in-place policy and the hard curfew. And I strongly support the additional measures the Premier is announcing for the shelter-in-place policy. We do need to toughen that up. So at the moment, we continue to be able to suppress what is still a small number of the positive cases that we are getting, which are occurring in clusters, and we're able to identify and suppress those clusters. And as the Premier said, the next key thing for us now is testing, 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 as the World Health Organization have said. And just to underline, there's a huge amount of work going on this, and it is very exciting that we have placed that order with South Korea for 200,000 test kits, because that will allow us to test people on the front line, test our emergency services, and it will allow us ultimately to test everybody on the islands. So suppression and testing is our way out of this, but we need all of you to cooperate with us on the advice we're giving you if we are going to be able to achieve that. In a longer term time frame, there's a lot of work still going on developing a vaccine, but that is still some way off. And science is also developing fast. The very best brains in the world are looking at this, and there's developments around some drugs that might help alleviate some of the problems that people have if they get COVID-19. So there is a lot of work going on that. I do also want to say, as part of our strategy, that HSA and our health authorities have done an incredible amount of work on additional beds and making sure that if we have a worst-case scenario, that's not what we envisage, and that's what we can avoid if everybody follows the advice. But if the situation develops in a negative way, we now have a lot of additional facilities for extra bed space. So the key message is that we are in as good a place as we could be compared to so many other places in the world. But we do need all of you to cooperate with the advice that is being given. I just finally want to make a shout out today to the people in GIS and our communications teams who I think are doing a fantastic job to get so much information out to you all via the media, via the government web pages, via social media pages. And today I arrived at Government Administration Building and saw a government vehicle which will be sending messages out via a public address system. So this vehicle will be driving through all districts, giving information about the soft curfew, social distancing and basic hygiene. And it's a really good example of an innovative way of getting information to people, perhaps some who don't have access to electronic media. So thank you to everybody who has been involved in that.
Thank you. Minister.
Thank you. Good afternoon, Cayman Islands, the listening public, Cayman Brac and Little Cayman. Thank you all so much for all the prayers sent to me in translations from the public. Glad to see your interest. It's a lot of people out there that appreciate the scriptures and prayers, hence the reason I continue to do them. Thanks for the love, respect, and encouragement. Today's scripture is Philippians 4:6. Do not be anxious about anything, but in everything by prayer and supplication with thanksgiving, let your requests be made known to God. There's an old African proverb that says, when you pray, move your feet. So if you're in your car praying before you go out on the road now for no reason, just open back up the car door and move your feet back inside. Persons are still having barbecues and small gatherings. We ask you to stop this, please, and adhere to the measures of curfew. I don't know if some people are really taking it serious or appreciating what we do on a daily basis. We are here to give comfort, to give information, to inform the current state of play, to consider information or questions sent to us by you, things we didn't think about. The Premier gives the world a report and gives insight that we are here, we are in this for the long haul. He also makes the country aware of additional measures and new regulations put in place and corrects fake news, etc., among others. The governor is here giving that assistance with all the chaos going on worldwide, that our mother country is there for us in whatever capacity she can be, and to give assurance he is satisfied with the government's actions and measures put in place. He gives the sense of comfort needed and gives the police and all the support needed to cope with all. My job is to be of great support to the panel as health minister with all the measures taken to give the public health all the financial support necessary for the equipment and personnel needed to ensure both private and public medical teams are prepared to work as a team when the need arises, to ensure the ministry gets the support with new regulations agreed by cabinet is legally scrutinized and fit for purpose, not to be ashamed of my faith and bring spiritual comfort during this period of fear, to ensure as much persons on the island understand that by staying home you can save not only your life, but your neighbors or your friends. So when you ask what we do or what role we play here, I pray this was helpful. In my effort to reach out to the 134 nationalities on this island, we're trying to get the message out to as much people as we can. Please stay home unless it's essential. Today's translations will come from the Dutch community. I thank those persons who submitted those to me. And it's from the Zimbabwe Africans community who submitted these to me also. So I'll go and take a stab at this. And in Dutch, or please stay home unless it's essential, is blijf alsjeblieft thuis tenzij het essentieel is. Zimbabwe Afrikaans is in Ndebele and Shona is Vanuatu, Halani, Nekaya, or Greyai Numba. I thank you. I want to shout out today the pharmacies and supermarkets for doing a wonderful job and keeping us alive, really, in all aspects. And I want to also shout out the curfew staff, the curfew time staff, who approve all the essential staff moving about. You're doing a tremendous job with all the thousands of applications that you get on a daily basis. Yesterday I spoke about our islands in need of blood donors with my appeal for people to help save life and give blood as our supply is currently low. I am pleased to report that nearly 50 people have reached out to the blood bank, both new and recurring donors, to make appointments to donate blood. This is a true testament of how our community can pull together to get through these times. That said, blood donations have an expiry date, so the need for donations is not only now, but ongoing for the foreseeable future. This makes me truly proud to hear our community stepping up like this. When we were on the 24-hour lockdown, the Health Services Authority pharmacy staff hand-delivered medications to patients' homes if it was an urgent need. 136 prescription deliveries were made to 65 patients across the whole island. Faith Hospital also provided this service with 30 prescriptions delivering to 10 patients. I'm pleased to announce that the HSA has taken an additional step and tomorrow will open another pharmacy location on the first floor of the Smith Road Center, which will provide more convenient options for persons to pick up prescriptions, refills while maintaining a safe social distance of 6 feet. The Smith Road location pharmacy will be for dispensing prescriptions, refills for cynical and private insurance members with 100% coverage. Pickup from this location will be for refills requested on or after today, Thursday, April 2nd. Can you send a photo for your refill prescription labeled via the WhatsApp number? Lastly, I also want to touch again today on the question of wearing masks. Dr. Lee reminded us all in the beginning that this is a new virus and we are always learning new things about the way it works. This would mean that as the pandemic evolves, the evidence we have will too, and this will also guide or change our advice in various areas. At this time, the World Health Organization is still studying the evidence about whether the general public should use masks during the coronavirus pandemic, who continues to recommend that masks should be used by sick people, caregivers or healthcare workers. I want it to be clear that there is a global shortage in masks, therefore N95 and surgical masks need to be left for our doctors and nurses on the front lines of this battle, as well as for those who are sick. Should you choose to pursue in making a homemade mask to wear while in public spaces, the fact still remains that evidence still shows social distancing and practicing frequent hand washing as the best defense against COVID-19. We cannot simply wear just a mask, as Dr. Lee also reminded us yesterday. In fact, if we all recall, the biggest drop in cases in China, despite people wearing masks, only came after 760 million people were told to shelter in place. This translates to the very thing we have been saying over and over again. Stay home, Kiman. Stay home to save lives. I also want to note yesterday a question was asked about the HSA and what supplies they had arriving on the island. I want to report that the list of supplies they have arriving is some 190 boxes of gloves. This is on a BA flight, I do believe, and 1,250 regular gowns, medium size, 1,250 regular gowns, large size, 10,000 N95 mask units, 600 surgical masks, boxes of 50, 1,250 isolation gowns, medium size, 1,250 isolation gowns, large size, 2,500 eye protection visors. I thank you and God bless.
Thank you, Minister. We'll turn now to questions from members of the media. I believe, Donna, you have one for us first.
I do. I have lots of questions actually from the public, but this one is for Minister Seymour as it relates to the blood bank and the 50 now persons who have said that they will donate blood. Someone is actually suggesting whether it might be better to have a blood donor vehicle go to those persons as opposed to having those 50 persons go to the HSA and be moving within the community.
Definitely something that I will take forward and pose to the CEO.
Okay. I do have some other questions. One relates to the port. It's more of passing on of information. There's some people who are concerned about workers at the port who are accepting goods into the country from other crews on ships that haven't been tested, and they feel that their families are feeling that they're exposed. Is there any thoughts given to that? And if so, is this something that could be looked at more closely as families are worried about those who are working at our ports?
Donna, I'm not sure I understand the question. Members of the port staff shouldn't be accepting something that is being brought and handed over to them by members of the crew of another vessel.
Okay.
So I mean, I don't know enough about exactly how things operate there, but I certainly will speak to the acting director, Joseph Woods. There's supposed to be a certain protocol involved in the discharge of cargo at the port. It shouldn't be handed to individual members of staff. But let me check on it. Let me check on it because, as Jamaican people say, if it not goes so, it nearly goes so. So let me check on it.
Okay. Thank you, sir. I think that's what they were trying to get to. Also, another question as it relates to exercising. Someone was suggesting maybe it could be considered, if it hasn't already been considered, that persons could go and exercise on days that their initials are open to going to the supermarket, so on and so forth, so that there's not a lot of people on the road exercising or on the beaches exercising on any given day. If this could be something that's considered.
Right. So we're still refining what the new shelter-in-place order will look like. There are competing views about what we do about exercise. There are some people who believe that that people should be allowed to exercise near their home every day. And then there are others who believe that that should fall into the same category as other essential errands. So we haven't settled on that yet, but this is always a tough balance, and the challenge really is for the Port Commissioner and his officers. We're trying to make it as simple as possible for them to be able to do their duty and do their job without having too many people to question. On a particular day, if you're out and your surname doesn't start with the right letter for that day, then you're in breach. That's quite simple. When we start introducing exceptions to it, then it makes their life that much more difficult. So we're trying to get that balance right, because cooping people up, this is tough. This is tough for everybody. And anybody who knows me would understand this is very tough for me too, personally, because I like to get out and about myself. Even though I may have an exemption, there's nowhere to go. So I have to stay home. So this is tough, and we really do appreciate that putting this in place for another 2 weeks is going to be very difficult for everyone. But the way I try to encourage myself is, we can suffer a little now or suffer a lot for a long time if we get this wrong. Because if we get this wrong and we wind up with significant community transmission, widespread community transmission of this, Cayman is going to be locked down for 3 or 4 months. Plus, we are going to have to view funerals of our friends and family via streaming, because we're not even going to be able to go in sufficient numbers. So suffer a little now or suffer a lot in the longer term. So I want everybody to choose to suffer a little now and put up with the inconvenience and the hardship and the loss of creature comforts that we are so used to. This is a national cause. It's about saving our own lives, as my minister would say.
Just to Donna, just to
yes,
to follow up before we lose sight of what you asked in terms of arranging a site or going to persons for blood donor. I've contacted the HSA, and as we speak, they are now organizing an off-site location that we can announce tomorrow. So thank you.
That's awesome. Thank you.
Real
I
time.
do have one. I have lots of other questions, and I know everybody else wants to get in. And I would just like to say to the public and reminding them that we can't possibly answer all of your questions, but they will be placed on gov.ky in a timely manner with the answers. But there's another question that I have for you, Premier McLaughlin. This one relates to the talks that are going on. I mean, I know that you get lots and lots of calls just commending how you and your government, other members of government and the cabinet are making probably the toughest decisions that have ever had to be made in the history of the Cayman Islands thus far. How are talks going with members of the opposition who may be giving suggestions and recommendations? Are they involved in the talks at all in representing the people, the Caymanian people?
I speak to the leader of the opposition quite regularly. I spoke to him this afternoon. I spoke to him yesterday. But we, quite frankly, getting together is not something we do very much. I hardly see the members of my cabinet now, and that's okay and that's fine. So we'd have to set up a Zoom meeting to talk about some of the broader issues. We have not really yet started to focus, as I said, on the broader economic sort of recovery plan, because we've been grappling with this particular issue, which is suppression of the disease, while doing everything we can to keep people fed, roofs over their head, and offering some limited assistance to small businesses. We're pushing that plan forward over the course of the next few days as well. But we certainly want the input of the opposition. The leader of the opposition wrote me a rather fulsome letter. I can't remember when it was now. The days just meld one into each other, but I think it's probably about 10 days ago, suggesting a number of things, some of which we are trying to move ahead with, things relating to pensions, payment holidays, and perhaps the ability of persons to access some of their pension funds during this difficult time. So we're taking some of those things on board. I'm having a discussion when I finish here with the pensions providers to see what their perspective is on these things. So we really need all hands on board. We need the private sector, we need the opposition, we need anyone who has ideas about these things to let us know. But in the end, we have to make decisions, and often we have to make the decisions quickly because of the urgency of the situation. So we're doing our very best in grappling with it. Every single day, there are a new set of issues and problems with which we have to struggle. And I really have to pay tribute to the governor for his willingness at all hours of the day and night to just engage on these issues. I don't know that I could manage without him, truthfully.
Thank you, Premier. I do have a question for Commissioner Byrne. This question relates to persons who are being, breaching curfew. And I know that you mentioned a number of times that they will be going to court and will be prosecuted. But some persons of the community are saying, like, why not do that now? Why not show how serious we are about them breaching curfew? Why wait until later on? That's the question in a nutshell.
Thank you, Donna. And I suppose the first thing to say is to re-emphasize it is a serious criminal offence, and all of the persons will
Be going to court. We're in the process at the moment of preparing our files, submitting to the director, and working with the court services to arrange the earliest possible court date for first mention. But it is a serious criminal offence.
Okay. Thank you, Commissioner.
Donna, we'll try to return to you with some more questions from the public if we have time. In the interest of getting round everyone, we weren't able to hear from Radio Cayman yesterday, so April, I'm hopeful we can hear from you today. Go ahead.
Hi, Carolyn. Can you hear me?
I can, loud and clear.
That's a good thing. So several of our viewers have and listeners have asked this question in different forms. Basically, as they watch the situation unfold across the globe, they're getting concerned about what our food security plan might be in the event that any of these of our normal providers stop distributing overseas. Could the Premier or anyone else kind of speak to how that's being addressed and worked on?
So that was one of the earliest, thank you very much for the question. That was one of the earliest issues that we addressed as early as when we started having the discussions with the private sector about closing the airport, which seems like a lifetime ago now. But all of the supermarkets indicated that they have a lot of stock. I think most of them actually have operations in the U.S. as well, that by which they source these various goods and products that they sell here. I think the only issue that we would have there is if the U.S. were to decide one of two things, to completely close their ports, and that is not impossible, or that supplies there got so challenged that they decided not to allow export. In which case, the supermarket folk have said to us they would be able to access product from South America. So that is their sort of backup plan. I don't have any more detail than that at this stage, but I know that currently everybody is quite comfortable with where we are with respect to food security.
Thank you.
Thanks, April. I know Cayman News Service has a question. Wendy, you're live.
Yes, please. Thank you very much. I'd just like to get some details, probably from either the Premier or the Governor, and a little bit more information about the 200,000 test kits coming from South Korea. Perhaps we could get some details on what types of kits they are and a realistic timeline. I mean, are they going to be coming on the British Airways flight? And also, on the same vein, is there anybody there from HSA that can confirm, or anybody that knows this, whether the Doctors Hospital and HCCI have started testing or are going to be able to test soon? Thank you very much.
Let me just answer that one on South Korea, Wendy. So the order has been placed, which is extremely good news, but moving anything around the world at the moment is incredibly challenging because everybody is trying to get their hands on these goods. We had hoped to get those kits on the British Airways flight. I think sadly that's just not going to, there just isn't enough time to do that. So our next challenge is to work out how we can get that here, but we have good options and we're confident we can do that. In terms of what tests they are testing for whether you have COVID-19 as of now. But we'll let you have more information on that as soon as we can.
Just to add further detail, the tests that are coming from Korea are for polymerase chain reaction test, the so-called PCR test, which is currently being used as the gold standard to say whether you have active disease or not. We have been advised by PAHO and also by Public Health England, two major public health bodies, that they are not recommending the use of immunoglobulin-based or serum-based tests currently until they've been adequately evaluated, because there are a lot of approved or kite mark things that have not gone through the correct approval process to see if they are useful at a public health level. Their success rates are not as good as you might hope they would be. As far as testing in other hospitals or organizations are concerned, Doctors Hospital are moving along very well with their plans. They have their own PCR machine, which is a new machine which arrived recently onto the island, and they're working towards getting that up so they'll be able to contribute to the testing. I understand their machine to be larger than the one at the Health Services Authority, so it is very likely they may be able to have a greater throughput than the HSA.
There's no follow-up, Wendy. We'll head to the Caymanian Times for their question.
I'm losing audio, so I didn't hear the end of the doctor's answer. I'm sorry. I don't know why, but I'm losing the audio.
Wendy, we'll make sure that we get you, we pick you up where you left off, unless, Dr. Lee, you could just give a brief sum up of the second part of your point there.
Sorry, Wendy, when did you start to miss?
Just as you were talking about the doctor's hospital.
Yeah, so they're working, they're doing well in their process towards getting up and running with the PCR technique themselves. They have their own machine, which is new to the island, and they may even, I understand it to be a bigger machine, so they may even actually be able to have a greater throughput than the Health Services Authority.
Thank you.
Ralph, go ahead.
Good afternoon. My first question is for the governor. Do you have plans, or are there plans for future British Airways flights, perhaps on a weekly basis? And can you say if there will be any supplies or any shipment or transshipment of supplies through the Cayman Islands for other overseas territories?
There are no current plans for a further British Airways flight, but clearly that is something which will be kept under close review when we have a clear idea of the demand for that. I think most overseas territories are procuring directly and having things sent to them by air cargo directly. But I'm sure, as ever, if we're in a position to, Cayman would want to support its overseas territories, friends and colleagues.
Thank you very much. The next question is for the Premier. Are other offices, such as the Post Office, going to be operational during the next 2 weeks of soft curfew?
I can't answer that question because I just don't know. And I hate to speculate or to give you a wrong answer. So can I ask you to let me answer that tomorrow, or send it to you directly as soon as I know?
Of course, of course. Well, I'll give another question that you can answer. There's a lot of concern about the BF flight that's bringing some of the Caymanians back to the island. I know you covered it yesterday, but could you give a brief explanation of what will happen when these travelers arrive on the island?
Okay, I think last count that we have now, I think there are about 60 Caymanians who are proposing to return on that flight. They will all, as a matter of law, be required to be isolated in a place other than their home. That's the language of the law. And in this case, it will be one of the facilities that is currently being used by the government for that purpose. And they will be under surveillance, and they will be required to remain within that facility for a duration of 14 days. It's not optional. It's not self-isolation. This is mandatory isolation under the provisions of the suppression of COVID-19 law, regulations and the public health law. Everyone is being told that up front. If you don't want to do that, don't get on the flight to Cayman.
And let me just add that there are 140 Bermudans on that flight as well, who are in the same position as the Caymanians, and they're going back to Bermuda, and the flight is going to Bermuda first. So there are 140 Bermudans on the flight and 60 Caymanians who were the highest priority compassionate cases.
Thank you very much. That's all for me for now.
Thanks very much, Ralph. We'll take another one from Radio Cayman. Felicia, if you can hear us, please ask your question.
Hi, good afternoon. My first question is for the Premier. How many people, do you have an exact number or a percentage of how many people have been labeled as an essential worker in the Cayman Islands?
I'm sure we have the number, but I don't know, because there'd be a lot of people, because if you just think about the government employees, the fire service, prison officers, police, medical staff, there'd be a lot of people just up front before you even get into the other persons who would have written in, or the companies would have written in and asked for for them to be exempted. Plus the utility companies and so forth. There's a lot of people in the thousands for sure.
Okay. And perhaps my second question will be better for the governor. We've heard of a hospital ship from the UK that has set sail. It's going towards the Caribbean region to provide support and assistance. Do you have any idea when and if it'll reach our shores, and what kind of help would they be providing?
I think you're referring to the ships that normally come out to the Caribbean for hurricane. This year, we're going to have two of those, HMS Medway and HMS Argus. And so they're both going to be in the region, and they clearly are there and available to support for any overseas territory that requires them. Well, perhaps on a future call, I'll get more detail on precisely what they've got on board. But clearly that's also helpful that they're both going to be in the region for the next few months.
Okay, thank you. That's all my questions.
Cayman Compass, I think you had another couple of questions for us. Reshma, go ahead.
Thank you, Caroline. I do have a couple of questions, starting first with just circling back to the South Korea kits. Do we have a figure of how much this is going to cost the Cayman Islands? I know the governor touched on the fact that it is COVID-19 testing kits, but can you say what kind of testing kits are they? Are they going to be the blood testing, the reagents? Can you provide us with a little clarity on that?
Dr. Lee is here.
I think you answered that, didn't you? Yeah.
You just did.
Reshma, as I mentioned previously, this is polymerase chain reaction. So polymerase chain reaction. So it's the same testing system that we currently use. It'll run on, I understand, either the health services machine or on the doctor's hospital machine. It's reagents. There are 2,000 sets of reagents, each of which can manage around 100 tests per set, which is why we're saying 200,000. The cost, I don't know if...
I don't think we should get into the cost.
Right, okay.
A lot of money.
But
I would imagine so, 200,000.
So if I just say a lot of money because we're getting so much, that is the reason why it's become a lot of money.
Okay, and maybe at a later stage we can provide an overall cost when those things are finalized. Just going back to the issue of the quarantine and the points that were made earlier, we had a question come in. The British Virgin Islands government has assigned security guard to the homes of people who are currently under isolation. Is that something that government is contemplating in the situation that we are in right now, where we are having people who are supposed to be in isolation or members of their households in isolation still going out into the community?
No, we haven't had that discussion about assigning security guards to people's homes. Not yet, not at all.
Is it something that you may consider, if not security, but at least police checks in the areas?
It is certainly something we'll discuss.
Okay, thank you, Premier. The alphabet schedule that we have implemented for the shelter-in-place provisions and those that will be renewed starting Monday. We've had complaints come in from the sister islands that these restrictions are not being followed at the supermarket. Could you just reiterate for those who may not understand how this shelter-in-place works, that it's not just Grand Cayman, that it also applies to the sister islands, and it's not a request, but an actual instruction or regulation?
But I think everyone knows that. I think though that we want to have a conversation with the two ministers from the BRAC as to how well the current system is working. It's not always a question of one size fits all, and it may be that some adjustment might need to be made with respect to the BRAC to make sure that the system works properly. The objective is to keep as many people off the road and out of the supermarkets as possible at any given time. the population of the BRAC is much, much smaller than Grand Cayman. So I think we want to have that conversation to see whether or not a separate or different arrangement might work better for the BRAC.
Many thanks, Premier. We've had similarly concerns. I know we are in a situation where the economic conditions or the climate is very unstable right now, but we have had concerns coming in from parents who are saying that the private institutions, while the schools are not in operation, they're still being asked to pay full tuition while being homeschooled. Is this something that has come to your attention, or is it something that some advice that you may give to the private schools and for parents in general as well who are facing tightening their belts in this current climate and having these demands being made on them at this point in time?
Well, I have to declare, I guess, an interest or at least a relationship. One of my sisters heads up Cayman Prep in high school. But what I can say is that for many of the private schools, I think almost all of them, they do not operate on a profit-making basis. They all have staff to pay and outgoings and usual outgoings. So I don't know the individual circumstances of any school in particular, but I was Minister of Education for 4 years, and I understand how private schools struggle, despite the high fees that they charge, struggle to keep operational. So I think we have to be very careful before we start saying to private schools that it should reduce fees, because then parents may find that they don't have teachers anymore to teach their children at home. So I think this is something that requires very careful thought and analysis before jumping to conclusions or making decisions which might mean that you compromise what is already a compromised education operation because of the circumstances. We don't know how long schools are going to be out, but if I had to hazard a guess now, it would be at least another 4 weeks.
Thank you for that. I appreciate that, and I understand that. Just continuing with my questions, if I may. Do you have any indication of how successful the homeschooling program has been going for the government schools, and the issue of having students who do not have internet access or access to electronics so that they can follow along as the process goes, given that, well, now it's going to be 4 weeks?
I haven't had any briefing on the education front there since the Minister of Education was here. I think it was last week. But we will get one and apprise the country of how well or not we think the current arrangements are going. I haven't heard, though, quite frankly, maybe one aside from the issue about cost, about school fees, I can't think of any instance that I've had a complaint from parents, which is a good sign. And I kid you not, it is not unusual for me to get 300 messages a day. So I think that's a pretty good indication that most people must think the system is working fairly well.
Reshma, if you could make this your last question, please, so we can get back to Cayman News Service before we run out of time this afternoon.
Okay, thank you. Just staying with that same school situation, we've also got complaints about the bandwidth speed and the ability to make this process effective. Everyone is working remotely now. There's a lot of pressure on the lines. And is there any discussion going on with the internet providers, the telecom providers, to open up the availability of the bandwidth so that they can assist the community in effectively doing their duties that are now heavily reliant on the internet?
Again, I've had no complaints about that, and we certainly haven't entered into those discussions. But opening up bandwidth is not something that you do at the touch of a button or a lever. So that would take some doing, I believe. But then again, that's not my forte. I have a scheduled conference, telephone conference with Ofreg this evening and this afternoon, so I'll raise the issue with them as to whether or not they've been getting complaints.
Okay, thank you very much. I'll give way to Kimanian Times.
Kiman News Service, Wendy, go ahead with your question.
Oh, sorry.
Thank you very much, Caroline. It's quite a quick one, actually. It's just that we've had a lot of people constantly calling us about what do they do if they see people breaching curfew. We're generally referring them to either 911 or the website. But one of the ones that keeps repeating itself, and it may be that some of them are exempt, I don't know, but MAL trucks. So can we just get just a quick confirmation of whether MAL trucks that perhaps are involved in government work are exempt? And secondly, exactly what people should do if they see people or businesses breaching curfew. Thank you.
Well, to answer the last question first, do what I do, I message the Commissioner of Police. I found that to be very effective. Now, I know everybody doesn't have access to him, and I'm making just a light moment there, but really do if you see breaches, call 911 and report them, and they'll be passed down the line, and someone will be dispatched to deal with it. Often, though, by the time the police are able to get there, the individual has disappeared. I know that happens all the time, but we can but try. The other question, the work at the airport to try to get the airport runway completed while there are no flights is going on. So the only trucks that should be on the road are those that are bringing aggregate for that purpose. I haven't had any complaints about other trucks working, but that doesn't mean they aren't. And again, if they are, we'd ask you to get their number and call it in.
Okay, we'll leave the questions from the media there for today. Thanks very much, everyone, for adopting the Zoom system with such enthusiasm. We appreciate it. Any closing thoughts from members of the panel?
Just wanted to, I guess this is a shout out to the police commissioner. I got a letter last night from a 7-year-old boy, Mr. Uter, who wrote a letter to the commissioner, and the commissioner, thank you for leading the police in protecting my family and my neighbors. I see them drive by my house in the night. If the police did not patrol the streets, then the people would disobey the law and more people would get sick. Sincerely, Ceteris Uter. I thought that the commissioner would enjoy that letter for the great job they're doing.
Thank you.
I've just been asked to point out that the emergency travel hotline, there is also an email address, emergencytravel@gov.ky. So if you want to send an email with your situation, you can do so as well.
Thank you very much. Thanks for joining us this afternoon. We'll be back tomorrow with another update. In the meantime, visit gov.ky/coronavirus. In particular, I'd like to draw your attention to the resources section, where we have a new digital information booklet available for you. It's full of guidance and useful information. You might be able to see an image of that on your screens now. You can also pick up a hard copy of that booklet at the supermarket when it's your day to go. So in the meantime, keep following us on social media, and we'll see you tomorrow. Thank you.